Hi, here's a new set of exercises for back care for August 2020. You will definitely need something just to pop between your knees to squeeze, and also a strap or a dressing gown cord or a belt would be really handy to help with your stretches. We're going to start off by lying on our back, concentrating on our lateral breath. Bring yourself into the crook lying position, place your hands on the front of the rib cage. Take a deep breath in. Feel the rib cage expand and both sides separate. Breath out. Notice how it recoils. Again, deep breath in. Expand into the rib cage, breathe out. Let it recoil. Breath in. And breath out. So we're really focusing on trying to fill the ribs from the bottom towards the top. One more breath in. And breath out. This time as we breathe in, we're going to tip the pelvis forwards, increasing the curve in the back. And as we breathe out, flatten the back. So we're having an anterior pelvic tilt, followed by a posterior pelvic tilt, and that should follow with the breath. We'll breathe in, breathe out. Try to really exaggerate the degree of curve in your back as long as that is appropriate for you to do so. Breathe in, breathe out. One more time. Breath in, and then breath out. You're going to hold the flat back, and we need that there as we bring one knee to chest. Lengthen the other leg away for our hip flexor stretch. Now try to notice and try to keep a straight line between your hip joint, your knee joint and your ankle joint, both on your bent leg that is close to your chest and also your straight leg that is reaching away. Release and change over. Now this might be really interesting because you may notice differences from your own positions on one side as opposed to the other. So for me on this side, if I don't think about what this straight leg's doing, it goes out to the side like that, and I have to really think about kneecap and toes up towards the ceiling to get an effective stretch into the hip flexors. Practicing fine control of pelvic tilt with pelvic clock next, we'll be moving our pelvis in a circle, tipping it to the side before tipping it backwards, tipping it to the opposite side and then returning to the neutral position. So if we return to crook lying, start in neutral, tip the pelvis side, tip it backwards, opposite side and neutral. Side, back, opposite side, neutral. Side, back, opposite side and neutral. Side, back, opposite side and neutral. Explore that range of movement and notice what it feels like. When we're not given a direction about which way to go in, we will initially choose the most logical and the easiest direction for us to move in. So we're going to do one more circle in this direction, then we're going to reverse it, go into the opposite side first, then back, side and neutral. So this may feel completely different, and it may feel a little bit tougher to control. Twice more. Last one. Okay, let's release the pressure from lying on our back, bringing ourselves to our side to bend the knees and take a stretch through the quadriceps at the front of the thigh. Try to maintain a straight line from the knee to the hip joint, moving your knee back beyond the line of the hip joint to deepen the stretch if you need to do so. Now we're just going to stretch that leg for this side, okay? We will be doing our side lying quad stretch on the opposite side a little bit later, so don't worry, I haven't forgotten. We're going to practice opening the hip, but without moving our pelvis when we practice the hip release next. Turn onto your back, bring your pelvis to neutral, so that the 3 bones at the front of the pelvis lie flat and level to each other. You should have a gentle curve in your lower back. If that feels exaggerated or very uncomfortable, just soften to a position where it feels a little bit less so. Keeping the pelvis neutral, staying with the same leg, we'll knee drop out, heel slide down, rotate to parallel and heel slide up. Making sure that when we knee drop out, we don't allow the pelvis to roll over to the side with the knee, but we keep the same contact point between the back of the pelvis and the mat. One more repetition in the direction that we're going in, and then we'll challenge our coordination by reversing the direction of the exercise, starting with the heel slide down, rotating out, heel slide up, and the knee drop comes in. Heel slide down, rotate out, heel slide up, knee drop brings it in. Heel slide down, rotate out, heel slide up, knee drop brings it in. 2 more in this direction. The last one. And then set that up on the opposite side. So reset your center, starting with knee drop out, heel slide down, rotate parallel, heel slide up, knee drop out, heel slide down, rotate parallel and heel slide up. Notice how this feels on this side. One more in the direction that we're going, and then we'll reverse it. Challenge your coordination. Start with heel slide down, rotate out, heel slide up, knee drop in. Heel slide down, rotate out, heel slide up, knee drop in. Heel slide down, rotate out, heel slide up, knee drop in. Last time on this side. Okay, we're going to stretch hip rotators. So I'd like you to place one ankle on the opposite knee and then press that knee away from you. Try to keep the pelvis neutral. So notice here if you have tipped your pelvis over to the side with that knee, and if you have, bring pelvis to neutral, keep it there, and then press that knee away. That should give you a much better, much more effective stretch. If you need to, you can have your foot on the floor closer to your bottom, making it easier to reach. Holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release it and change it over. So again, pelvis stays level. We press the knee away. That foot on the floor can come closer if you need it to. And we hold it. For 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And then when we release, let's take our pressure off. Go onto your opposite side and take the stretch into the front of the thigh. Now it is important that we try to keep our hip joints as mobile as we can, because if we lose the mobilization in the hip joint and the range of movement in the hip joint, then it can have repercussions on the position that our spine is able to get into. If we keep the hip joint nice and mobile, we maintain the ability to get the spine, the pelvis into neutral when we're standing up, and then the spine into neutral on top of that pelvis. Whereas if we lose the range in the hips, you'll find that it's very, very hard to get a neutral spine, neutral pelvis when we're standing up, because what will happen is rather than our pelvis being upright like this, our pelvis will be tilted forwards like this, and these muscles will be so tight that they won't give out to let us do this, okay? And then that means that it's going to put a lot of pressure on our back to try to be upright. Okay, so we're on to shoulder girdle next. You can sit for your protraction retractions, or you can kneel, or you can stand if you would prefer to. If you're happy lying down on your back for them, bring it to your reclining position, float the arms to the ceiling, breathe in, reach, breath out, connect. So we separate the shoulder blades as we breathe in, we draw them together as we breathe out. Breath in, breath out, breath in, breath out, breath in, breath out, and last one, breath in and breath out. Let's stretch hamstrings. Keep pelvis neutral for this one. If you've had sciatic nerve irritation, then keep a little bit of a bent knee when you stretch your hamstrings. If you haven't, it is perfectly fine to go to a straight leg. So we'll bring our leg as close as we can to feel the stretch into the back of the thigh. Relax into the position. Holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release that leg down. Same stretch, opposite leg. Holding 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release. Now the next exercise will challenge our ability to keep our pelvis and spine in neutral, but also the strength of the thigh muscle. So maintain the neutral, slide one leg away so it's straight, and we're going to do a set of straight leg lifts and lowers, just to roughly a 45-degree angle, which is parallel to the other thigh. So we lift and lower and lift and lower. 3 and lower. Now we're doing sets of 10 of everything. Okay, 4 and lower. 5 and lower. If you reach fatigue before we've done the set of 10, you take a break. 7 and lower. 8, lower. 9, lower. Hold the last one for 10. Ankle circle 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. Reverse the circle 10. 9, 8, 7, 6. Now we're working our thigh statically, so you're going to feel that. Make sure that your knee doesn't start to bend. It will do that to make it easier. And then our last set of 10 is point and flex. Point, flex. 2, flex. 3, flex. 4, flex. 5, flex. 6, flex. 7, flex. 8. Are you still neutral? Have you still got your curve? 9 and 10. Release it down, slide it in. So what can sometimes happen with that is we can result in a posterior pelvic tilt and a flat back to take some of the work out of the leg. Okay. So holding neutral again, the neutral is the important. We heel slide. Leg lifts. 10. Lower. 9. Lower. 8. Lower. 7. Lower. 6. 5. 4. 3. 2. Hold the last one, holding neutral, ankle circle. So the knee stays straight, the pelvis and the spine stay in neutral as we move the ankle. The ankle circle is important because it exercises the muscles in the lower calf and the lower shin. 3, 2, 1, reverse. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, point and flex, point, flex, 2, flex, 3, flex, 4, flex. Are you still neutral? Have you still got a straight knee? 6, flex, 7, flex. My thigh is yelling at me. Flex, 9, flex, and 10, flex, lower, slide it in. Wonderful work. Moving to sideline for chalk circle. Now this is a variation on sideline spine rotations, and it does need a huge amount of room to work on this one. If you find you do not have a huge amount of room, please work either with a long lever, straight arm, or an open door arm line for your chalk circle. So we circle in one direction, which is above the face, over the head. As we go behind, it's usual that our hand will come off the floor at that point. So we're opening the chest as we circle back, and it'll give us a range of movement stretch through the muscles at the front of the shoulder joint, as well as the mobilisation aspect that we would get into the thoracic spine from our regular sideline spine rotation arm line. We'll go for 2 more. And final one. Moving to 4-point kneeling for cat stretch. Placing our hands under our shoulders, our knees underneath our hips. Take a breath in, and on the breath out, flex. Breath in, extend. Breath out, flex. Breath in, extend. Breath out, flex. Breath in, extend. 3 more repetitions. Last one. Releasing back into shell stretch when you've finished it. Holding for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then releasing. Let's practice sideline chalk circle facing in the opposite direction. So set up sideline neutral, use your pads under your head, right angle at the hip and knee joint, circling in front of the face, over the head, and around behind ourselves. Maintaining our knee position, stacked on top of each other, connected to the floor. One more circle on this side. And then we'll be practicing our breaststroke preps next. Lying face down for the breaststroke preps with a small pad underneath our head to maintain a neutral neck. Stage 1 position, we bring the arms to W, the legs are parallel. With our core gently engaged, we slide the shoulder blades down the back. Peel the face and chest off the mat. Release the chest and the face to the mat. Release your shoulders towards your ears. Exhale, slide the shoulder blades. Inhale, peel the face and chest off. Exhale, release the chest and face down. Inhale, release the shoulder girdle. Exhale, slide the shoulder blades. Inhale, peel the face and chest. Exhale, release the chest and face. Inhale, release the shoulder girdle. So we've got depression of the shoulder girdle, followed by a gentle extension into the neck and the upper part of the spine. So that's the cervical spine is our neck and the thoracic spine is the back of the rib cage. For stage 1, it's important that you keep the curve at the front of the ribs connected onto the mat and try to raise your chest only, as that will result in thoracic extension. So you're decreasing the pressure of your chest against the mat as you peel up. And as long as that pressure decreases, you are doing perfectly. One more time through. Now stage 2 is completely different. It's about bringing the shoulder blades towards each other and increasing the curve in the lumbar region, that is the lower back, the space between the ribs and the pelvis. Hands are by our hips. We retract the shoulder girdle and externally rotate the shoulder joint. Float into the lower back. Release the lower back, release the shoulder girdle. Exhale, shoulder blade, shoulder joint. Inhale, lower back. Exhale, release the lower back. Inhale, release the shoulders. Exhale, shoulder blade, shoulder joint. Inhale, lower back. Exhale, release the lower back. Inhale, release shoulder girdle, shoulder joint. So we squeeze, lift, lower, release, squeeze, lift, lower, release. Last one. Squeeze, lift, lower, and release. Now stage 3, we place our fingers underneath our forehead. We want our legs to stay on the floor. You may find that you need to modify this and keep one arm down on the mat, which is fine. With our fingers glued to our forehead, we exhale to float. Inhale and lower. Exhale and float. Inhale and lower. So we're strengthening up the muscles that will hold our lumbar curve in a curvy position rather than in a flat back position. If we spend a lot of time sitting down, as a natural course of things, the curve in our back is flatter when we are sat down compared to when we are standing up. And if we sit for a long time, the muscles in our back will get used to being flatter and they will do this when we stand up. And having a flat back puts us at increased risk for disc prolapse, so it's not a good thing. Last time through. And then we're moving into a high shell stretch position. Come up to kneeling with your pelvis above your knees. Place your arms forwards and then try to get your face and your chest down towards the mat. If this position is not comfortable for you and you're not comfortable kneeling, it's actually a stretch for our chest. This can be done by coming to a seated position instead. I'll go side arm. Taking your hands behind you and squeezing your arms backwards like so. Okay, release. I'm going to give you 2 positions for the next exercise. We'll be working on hip extensions with our foot flexed. Position 1, you can lie on your tummy, have your hands underneath your head, bend one leg at the knee, and then keeping your hip bones down, this is what you're going to try to do. So you have to make sure that you don't do this because this isn't hip extension. Okay, so your hip has to stay in contact either with your hands that you've got on the mat that you've got underneath your pelvis, or with the mat. You don't need to pop your hands underneath there. It's the front of your thigh that you're trying to get off the mat. Slightly more challenging position because you've got to support your body weight would be either to work from 4-point kneeling or resting on the elbows if your wrists are uncomfortable with your 4-point kneeling position. So we're working a set of 10 on each leg. Now, if you've been going since I started instructing, now change legs and work on the opposite leg. Notice any differences from one side to the other in whichever is your chosen position. So you've got a fair amount of feedback if you're lying face down on the mat as to how much of the front of your thigh you can lift off the mat. So you will feel that. Whereas you don't have the same range of feedback from feeling the front of your thigh touch something if you're working either from 4-point kneeling or from the elbows because your thigh doesn't touch anything. So just keep working through sets of 10 with this one. It's a really, really good exercise for the glutes, the gluteus maximus. That is the biggest of our buttock muscles. And they are responsible for hip extension. Now this ties into the position of the pelvis. So if these muscles are too tight and we don't have a straight line here at the front of the pelvis, then that puts the buttocks on stretch all the time, so they become long and they become weak, and then it's hard for us to get a hip extension because it's actually so far back that we need to go because our pelvis is tilted forwards. Our aim with this one is to do 3 sets of 10 on each side, and I think we've probably had adequate length of time to be able to do that. So we'll move on to Cobra next, where we're going to go up onto our elbows. If that does not suit you, please work on your cat stretch instead. It's important when we practice Cobra that we have a wide leg position. Do use the edges of your mat to place your feet on. Start from the top of the spine, articulate towards the bottom until you're propped up onto your elbows. You roughly want your elbows underneath your shoulders here. Releasing down, pushing up, and releasing down, pushing up, releasing down, pushing up, and releasing down. There's no release on this one. We're going to push up to Cobra, prop ourselves onto our elbows, and try to relax our back muscles into the extended position. It may help to think about trying to push your tummy muscles towards the mat in order to get your spine to extend. Hold for 4, 3, 2, 1. Releasing out of Cobra. We're going to work on hip rotations again from a prone lying position where we're lying down on our tummy. Keep the wide position with your feet, tuck your toes under and contract your thighs. That should make the fronts of your kneecaps come off the mat and some part of your thigh as well come off the mat, okay? So you've got static contractions initially of your thighs. Stay at this level if you find that that is quite a difficult thing for you to do. If you can do the static contractions of your thighs quite easily, what I would like you to do is statically contract, roll heels in, roll heels out, release the thighs. Contract, roll the heels in towards each other, roll them out, release the thighs. Statically contract, roll the heels in, roll the heels out, release the thighs, and again statically contract, roll the heels in, roll the heels out, release the thighs. Statically contract, roll the heels in, roll the heels out, release the thighs, and one more time, statically contract, roll the heels in, roll the heels out, release the thighs. We're using shell stretch to the sides. So if you are happy to sit back into shell and go to the side, please do so. Taking a lateral stretch into your body. If that does not work for you, a seated side stretch where there's no pressure on the knee is a really nice substitution. We'll hold for 5, 4, 3, 2, 1, and then we'll take it to the opposite side. Holding 5, 4, 3, 2, 1, releasing. Side plank is our next exercise to practice. If you do manage a sore shoulder that does not feel comfortable in weight bearing, I should very much like you to practice side lying double leg lift and hold. So you would be in this position instead, and you are going to hold your legs off the mat for the same length of time. That is going to be 30 seconds. That the rest of us are going to be in our side plank position. So you can choose your prep level with your knees bent, your full level with your legs straight. Lengthen to neutral, lift and hold, so 30 seconds. Staying as steady and still as we can for those 30 seconds. If you do find yourself losing your alignment at any point, it is absolutely fine to release out of it. Now, the good news is that we have been here already for 20 seconds and we've only got 10 seconds left. Count down 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release down. I'm going to give you 2 positions for the next exercise, which is the swimming prep exercise. If you're happy to lie onto your tummy for this one, you're lying on your tummy. Legs and arms extended, straight leg lift, opposite shoulder extension before lowering and switching, lowering and switching. If you find that lying on your tummy is not a good position for you to be in, then you can work your swimming preps from neutral 4 points. Shoulder and hip, opposite side. Lengthen and release. Now, although our spine does not move during this version of the swimming prep, either in your prone lying position or your 4-point position, you will be getting passive work through the muscles of the spine when you raise the hip into the extension position and the shoulder on the opposite side into the extension position. Because both of those muscle groups feed diagonally through the body across into the thoracolumbar fascia, which crosses that lumbar region. So by moving hip and shoulder extension on opposite sides of the body, we get some passive exercise for the muscles of the lower back. So this is a really, really good exercise to practice just to keep strength in the lower back. Whichever position you've chosen to practice your swimming preps in, I would like you to do 4 more, please. When you have finished your last 4, we'll recover either with a wide shell stretch where you have your feet close and your knees nice and wide apart before resting down into your shell position. If your knees don't particularly like to be in shell, then I would suggest a seated short adductor stretch instead, having your feet together and pressing the knees open to the sides. And you should find that that stretch will come across the groin here. We'll balance up the work that we did on our side plank or our side lying double leg lift to hold as our next exercise. So do prop your head up if you're doing your side lying double leg lift and hold. That will help you to maintain your neck in neutral. It's quite hard to hold your neck in neutral because your head's so heavy if your head is just still in space. For your side lying double leg lift to hold, prop your head up, cross your arms, legs are glued together. 30-second hold, remember, with your heels and your toes squeezing together so you don't let your legs do this, which may be what they want to do. Side plank position for the rest of us. Lengthen, lift and hold. Breathing as we stay. If you're in your side plank, it's important that in order to maintain shoulder, your elbows directly underneath your shoulder. If you get that angle wrong and it's too far out here, you'll find that that will really strain your shoulder to try to stay in your side plank position. Last 3, 2, 1, releasing down. Now we're coming into our seated position. And we're going to attempt a pelvic tilt in seated. With our knees bent, we're holding onto the backs of our thighs. And then we're just letting ourselves roll back off our sitting bones onto the back of the pelvis and stack to neutral. Now this is your first phase rehab to try to load the discs when you have previously had disc issues. So you'll find that pelvic tilt will be one of the toughest things for you to regain, and that's what we're doing now. We're tipping our pelvis, but from a seated position. So if this is ever too much, do it from lying down on your back, please. Last time through. Now we're going to practice our prep next so that we strengthen our core muscles in neutral. I'm going to use my knee squeezer pad so I get a little bit of inner thigh. So if you've got something to pop between your knees, use it. We're lying down on our back. Use a head pad underneath your head if it feels like your chin's poking up into the air. 3 bones at the front of the pelvis, the pubis and the 2 hip bones, flat and level to each other horizontally because we're horizontal. Keep them that way and that should give you a nice curve in your lower back. Arm line can be either your hands staying down by your sides. To make that a little bit tougher, you can cross your arms over your chest, and then taking the weight even further back, you can place your fingers behind your ears. So each of those arm positions makes the weight that you are lifting slightly heavier. However, you may find that fingers by ears just takes any tension out of your neck muscles. So even though this is the heaviest weight to lift, it may be a bit easier on the neck muscles. Holding neutral, we take a breath in to engage the core and tuck the chin. On the breath out, we rise the head, the shoulder blades, the arms just up off the mat. Holding our position, we breathe in, stay. And breath out, lower back down. Breathe in, engage, rock the head into chin tuck. On the breath out, we're lifting our head, our shoulder blades, our arms off the mat. Breathe in, hold. And breath out, lower. Breath in, rock. Exhale, lift. Inhale, hold. Exhale, lower. Breath in, engage and rock. Breath out, lift. Breath in, hold. Breath out, lower. Breath in, engage and rock. Breath out, lift. Breath in, hold. Breath out, lower. Last one, breath in, engage, rock. Breath out, lift. Breath in, hold. And breath out and lower. Now we are going to stretch our hamstrings, but in a slightly different way. I'd like you to keep one foot on the floor with your knee bent, and then bring your other knee as close as you can towards your chest so that your thigh comes close in towards your chest. Keeping your thigh this close to your chest, start to straighten your leg out at the knee until you feel a stretch into the belly of the muscle at the back of the thigh, and we'll hold it there. For for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release that and change it over to the opposite side. So we've got one foot on the floor with the knee bent. The other knee comes as close to the chest as we can get it. And then we start to extend the leg at the knee to feel the stretch into. It's the short head of our hamstrings muscle that we're getting the stretch into here. So the long head of the hamstrings attaches onto our sitting bone, whereas the short head is attached to the thigh bone, so it doesn't actually cross the knee. Ten, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then we'll release it down from there. Side lying scissors is our next exercise. Prop your head up to help you maintain neutral neck and turn onto your side. Lying in as straight a line as you can, so really lengthen across the front of the hip here. We're going to pick our legs up into the air, keep them there. Now you may find that you need to place one hand down onto the mat to do that, that is fine. Split the legs, one forwards, one back, reach, 2, 3. So it's a little bit wobbly if you've got both arms crossed over your chest. 7, 8, 9, and 10. Bring the legs together, release it down. From there, we're going to go onto our back. So reduce the height of your head pad. We'll be practicing knee folds in and out of tabletop. So I would like you to keep your pelvis and your spine in neutral with your core muscles softly engaged. Single knee fold. You're aiming to keep your pelvis still as you bring one leg at a time to tabletop, moving from your hip joint and maintaining the angle at your knee. Your body will cheat by bending your knee and putting your foot on the floor closer to your bottom. So do make sure that you're not doing this, straightening and bending your knee, and your heels aren't too close to your bottom. That will make the exercise ineffective. So keeping the right angle at the knee. If you are strong enough to come to double knee fold, one leg goes to tabletop, the other leg comes up to meet it. One leg at a time we release out and we change the lead leg, bringing the opposite leg into tabletop, other leg to meet it, one leg at a time back down. Now if you do find that you're not quite strong enough to get to tabletop with both legs, then when we are going to work on our single leg stretch, you may find that you would prefer to work, rather than single leg stretch, alternate heel slides down the mat. And that is the movement that the single leg stretch does. But the start position is different. So the start position is tabletop. So if you're working double knee fold, stay tabletop here. And then the single leg stretch, we glide, return, glide, return. So that is the same movement that you would be doing down here, glide, return, glide, return. But with your feet on the floor, the intensity is lowered and the amount of work that your core muscles have to do to hold the pelvis and the spine in neutral is lowered compared to when you have your heels in the air and at your tabletop position. This is very intense, everything's having to work very, very hard. We'll make these our last 4, return, 3, return, 2, return and 1, and then we're going to do side lying scissors facing the opposite way. I will turn my back to you for this one. Prop your head up again. Cross your arms over your chest, placing one hand down if you need to, and make your body as straight as you can. Keeping your feet glued together at the knuckles of your toes, and your heels will arise. And then split the legs for scissors. 1, change 2, change 3, change 4, change 5, change 6, 7, 8, 9, 10. Squeeze the legs together, heels and toes together, and release it down. Super. Okay, we're going to tackle shoulder bridge next. So use your knee squeezer. And what I would like you to do, we're going to change the position of the feet for shoulder bridge, okay? So initially, I would like you to lift your toes off the floor so you're on your heels, roll up into bridge on your heels, and then when you get to the top of the bridge, so this should be nice and flat here, change your foot position, come onto your toes and roll down. And then rock back onto your heels to roll up, rock forwards onto the balls of the feet to roll down. So we're practicing spine articulation, but we've also got a little bit of ankle articulation going on here as well. So on the heels to roll up, on our toes to roll down. Now some of you have probably guessed what I'm going to ask you to do in a moment. And we're going to reverse our foot position. So going onto our toes to roll down. So if we stay on our toes and roll up, and then rock onto our heels and roll down. Rise onto the toes, roll up, rock onto the heels, roll down. Rise onto the toes, roll up, rock onto the heels, roll down. Twice more. Rise onto the toes, roll up, rock onto the heels, roll down, and last one, rise onto the toes, roll up, rock onto the heels, roll down. Let's release that with a full body stretch. Legs long, arms extended. Bringing the arms into a W position here. Try to flatten the back of the wrist to the mat. Bring the knees together. Now they should be adducted. So the knuckles of your big toes and your ankles pressed together, as well as your knees squeezing together. Moving from the pelvis, maintaining the legs adducted together. So it looks like we're rolling our knees over to one side and then back through center before rolling over to the opposite side. If you wish to, please explore range of movement, how far over you can press, keeping the foot and knee position very precise. Aiming for 4 more repetitions. When we finished our last one, we will come back into center. Now's the time for that belt, strap, dressing gown cord to come in handy to assist us with our stretches. Start off by having one leg straight, hooking the strap underneath the arch of the opposite foot, bending the knee to bring it in towards the chest. Allowing your pelvis to tilt backwards and your lower back to flatten to the floor, to stretch into the hip flexor. Now, the hip flexor stretch should be felt across the front of this straight leg. If you feel nothing, it may be an idea to lift your pelvis a little bit, and I'm going to do that just by popping a hard block underneath my pelvis. That allows the angle at the hip joint to increase, so that when I bring this leg in, I can now feel a stretch running across the front of the straight leg that I didn't feel previously. Okay, we're going to release. So we don't need the block if you used it for the next stretch. Take it away from your pelvis, but keep that strap underneath the arch of your foot. Lengthen your leg, allow your arms, your upper arms to be on the mat, and use the strap to pull that leg to the point where you can feel hamstring stretch. So this should be somewhere from the calf across the back of the knee, across the back of the thigh, and maybe even into your sitting bone here. The next stretch we're aiming for, we'll get down the outside of the leg. It's important that you've got the other bent knee quite far away because this leg might get in your way a little bit if it's too close up here. We're pulling the leg across, but keeping the pelvis on the floor. So we don't want the pelvis to lift up. So pelvis is anchored and you're bringing the leg as far across as you can. You'll feel some sort of stretch coming down the outside of the thigh as you do that. We'll be moving from outer thigh stretch to inner thigh stretch next. Again, using the length of the strap, so you're going to allow the strap to go longer and take the leg out to the side as far as it feels comfortable to go. Allow it to sit in the strap and let it relax into that strap. Releasing the leg. So these stretches are all designed to really try to keep the hip joint stretched out and mobile. We'll do the same stretches on the opposite side. So I'm just going to pop my pelvis up on something so that when the straight leg goes away, I can really feel that stretch. So we're bringing knee towards the chest. We want to hold each of these stretches for anywhere between 20 or 30 seconds. And it can be quite important to do these stretches every day if you find that either the range of movement in your hip joints is reduced or you have issues with knee pain. A lot of our knee pain will come from an imbalance of the muscles around the hip. So when some muscles around the hip get a little bit weak and others get strong, it can change the pull, the mechanics of the kneecap and lead to knee issues. So by making sure that the hip joint moves properly and that all of the muscles are functioning, then that can help us to decrease any knee issues. So the next thing we go to is our hamstring stretch. So I'm going to get rid of that block and we're going to a lovely long leg. Aim here is to try to keep the curve underneath the lower back and the pelvis in neutral when we do the hamstring stretch, because our hamstrings originate from the actual pelvis itself. The next one we're going to do is that outer thigh stretch, so just make sure that this leg's far enough away that when you cross over it's not going to get in the way. So you come across the midline as far as you need to go. Try not to let your pelvis roll over, keep it anchored. And then we'll move to the inner thigh stretch next. I need to just move my position, taking that leg out as far as we can. Let the foot sit in the strap, it's supported with your arm holding it. Last 10, 9, 8, 7, 6, 5, 4, 3, 2 and 1. Release it. We'll use the strap around the back of one thigh next. I'm going to double mine over just because that's a little bit easier for me to do. So with the strap around the back of the thigh, your other leg that doesn't have the strap on, prop it up on the knee. And then use the strap to pull both of those legs towards you. And the stretch should be in the outside of the hip. We'll hold again for another 10 seconds, counting down 10, 9, 8, 7, 6, 5, 4, 3, 2 and 1, and then releasing down. Reverse it, so pop the strap around the back of your other thigh, place your ankle up onto that knee, use the strap, pull up, and take that stretch into the other hip this time, holding. Last 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then release it down. Now we're going to move position onto our side and push ourselves up through seated. Do take your time if you find that moving from lying on your back to being in a seated and then a standing position affects your blood pressure. For those of you who have knee issues, the next exercise that I'm going to give you is a really wonderful one to work on to strengthen the muscles around the knee joint to help reduce your pain. It's called a wall squat. And I'm just going to use the wall over here to demonstrate. So when we're doing our wall squat, we want the back of our head, our shoulder blades and our sacrum to touch the wall or to get as close to the wall as we can. If we have a little bit of an exaggerated curve in our upper back, it can be really, really hard to get our head onto the wall. So if that is the case, just pop a cushion behind your head, okay? You're going to come to the wall, but with your feet away from the wall. Rest your pelvis, your shoulder blades and your head against the wall. And then your aim is just to shuffle down to the point where you can feel your thigh muscles working, but you don't have any undue pressure or pain in your knees. I'm going to hold the position, press your arms against the wall. So you've got nice long collarbones, everything pressed back. And we're holding statically for as long as we can. So if you can do another 10 seconds, that's brilliant. And if you can build this into your everyday life, even if it's just short bouts of 10-second holds, maybe when you're making a cup of tea and you're waiting for the kettle to boil, then that will really work on developing the strength in those muscles. I'm going to bring myself off at that point. I hope you've enjoyed the session and you've got a lot from it, particularly about keeping the hips stretched and mobile to reduce any knee issues. Well done.